All right, we're going to turn our attention now to today, a big anniversary. It marks 1 year since the launch of ChatGPT to the public and the start of what's become a year-long AI arms race, capturing investor enthusiasm and massive attention across industries from chips to the cloud to personal AI assistants. One industry on track for a potential AI revolution, that's healthcare. Estimated to be worth nearly $190 billion in 2023, up from just $11 billion 2 years ago. Joining me now to discuss this and much, much more, Bob Garrett, the CEO of Hackensack Meridian Health, New Jersey's largest healthcare network with 18 hospitals employing more than 36,000 people. Good morning. Thank you for being here.
Good morning, Frank. Good to be back with you.
So let's just talk. How do you view AI when it comes to your hospital system? What are the challenges? What are the opportunities?
Yeah, so, Frank, what I see as AI, I see it as really the most profound technology in the world today. If you think about it from a healthcare perspective, whether it's helping doctors diagnose disease earlier or helping more people enroll in clinical trials, there's no question that AI can improve healthcare in remarkable ways. And just think about the global picture. 100 million Americans have an undiagnosed chronic disease. 90% of all healthcare costs today go to treat chronic diseases, about $3.7 trillion a year, according to the CDC. AI has the potential to help diagnose disease earlier, help treatments get online quicker, and even address physician burnout. So that's why I am so enthused about AI. Having said that, though, Frank, it's we have to look at it very strategically. We have to be careful how we deploy it. We have to be sure that there are the right governance mechanisms in place to make sure that it's used for the right purposes. So we at Hackensack Meridian have really focused on three areas. One is to really improve clinical outcomes. Number two is to improve efficiency throughout our health network. And three is to give patients educational materials through AI that were not available before.
Got it.
And we put
we're showing
together
your audience your AI areas of focus right now. I do want to talk about some of the safeguards that you're putting in place. Elon Musk, I don't know if you were watching this at the New York Times Dual Book Summit, talked about some of the challenges and potential dangers when it comes to AI, the fact that AI might be smarter than any person on the world in just a few years. So when you look longer term when it comes to AI, are we looking at a day where AI may make decisions about our health without human input or intervention? How do you move it forward?
I don't see that at all. I think that human input is going to be very important. Human oversight is important. We've piloted with companies to help us on the governance side, Frank. So as an example, Google Cloud, they help us. They provide their expertise, what they've seen around the world in terms of AI governance. We match them up really with our own clinicians, with our operational experts, with our IT folks to make sure that whatever pilots that we roll out, that there are the safeguards in place. So just to give you a couple examples.
Well, before we get into the examples, I want to ask you about something that you mentioned just a short time ago, some CDC data. 90% of all healthcare costs, this really amazed me, 90% of all healthcare cost is for chronic diseases and also mental health treatment. So if that's where 90% of the cost is and AI has a chance to reduce doctor workload, I would assume reduce nurse workload as well. Does that mean AI is going to reduce the cost of healthcare?
It will absolutely has the potential to reduce the cost of healthcare, and we're seeing it again. As just to give you one example, we're looking at AI in improving our operating room efficiencies as an example. So right now there could be holes in our operating room schedule. Through AI, we can make healthcare more efficient by filling those holes and putting patient operations in place sooner. So patients benefit. They don't have to wait as long, but it makes healthcare more efficient. In the area of imaging, as an example, where it's helping radiologists who really have to read hundreds of images a day. It helps them prioritize those that they need to do quicker. Maybe scans that look like they're positive and there might be a cancerous mass, as an example.
Got it. So a lot of challenges and a lot of opportunities when it comes to AI.
There are a huge amount, but honestly, my takeaway though is let's not let the challenges get in the way. Let's be optimistic. This has an opportunity to truly transform healthcare.
All right, Bob Garrett, CEO of Hackensack Meridian, says AI could potentially lower healthcare costs and also get more people the treatment they need. It is great to see you. Thank you for being here. Well, in healthcare, it's not just the providers working to figure out the best way to utilize all of this new AI tech. There's also a massive market for wearables made by Apple, Garmin, Fitbit, and other companies, including smart ring maker Oura. The AI wearable company is a CNBC disruptor and one that just expanded its ecosystem to more than 600 third-party partnerships. Joining me now, right here on set, is Oura CEO Tom Hale. Tom, thank you for being here.
Thank you, Frank. It's good to be here.
So I'm going to assume that ring on your hand is an Oura.
It is. It's an Oura ring, and it's tracking my health right now.
All right, so I got on a Fitbit.
Yeah.
Give me a sense. I don't think this is powered by AI at all. What's the difference between something that we already all know about, a Fitbit, and the Oura, and what are the benefits for us?
Well, of course, you know AI is powered by data, and data needs to be high quality. So the main differences of the Oura is that it's measuring from maybe the most accurate side on the human body, which is right here on your finger. It's also presenting that information to a set of algorithms that are making predictions about you. It might make a prediction about how your day is going to go, or maybe, when, if you're a woman, when your cycle is going to come, or maybe you're getting sick. And those predictions are powered by machine learning and by AI algorithms. The power of this is that, of course, AI is only as good as the data that feeds it. And so you want as high quality and as continuous data as you can get. So, for example, we can track your health and understand how you are changing over not just, a day or a workout, but over weeks or months. And seeing deviations in your baseline is what allows the system to make predictions about your health.
All right, so this ring, you're saying it's the most, I didn't realize it's the most reliable place to get information about you and your body?
Think about when you go to a doctor, where do they put the pulse monitor? They put it right at the end of your finger. That's because there's like uniform tissue here and the signal's very strong. Your heart pumps, the blood goes straight down to your arm. Right here, you're getting return flow that's going back to the heart.
So it makes sense to have a ring.
Exactly.
I do want to talk to you about some of the challenges. So you just mentioned there's a lot of data just flowing through that ring, I'm assuming to some servers that you have. How do you protect your customer data? They're not patients, but I'm sure privacy is a key concern.
It is a critical concern. Obviously, we need to be sure that your data is protected. We will never share or sell your data without your consent. We will absolutely make sure that it's encrypted and secure the whole way through. We think of ourselves really as governed by the same rules as the healthcare industry.
So I do want to ask you, I don't know if you can hear, I got a little sore throat right now. What could the Oura do if you're about to get sick or you are sick? I mean, what can it do to treat the problems that you actually have? I understand diagnosis. That's great.
Well, so much of what, I think defines our health is actually defined by your behaviors and the choices that you make. Let's say you're getting sick and you feel it coming on. Well, you're probably going to change your behavior. But sometimes actually your body is reacting to something that's happening to you and you don't even realize it. And maybe the ring will pick it up. So famously, Oura is well known for something called the TempRedict study, which was able to see signals of COVID 2.5 days before symptoms emerged or before a diagnosis came through. And this is peer-reported journals in Nature. This is going to tell you all this stuff. Now, what's amazing about that is that your body is actually telling you things, and sometimes you can't hear it. You're just not sensitive to it. And what the ring does is has a very clear picture of what normal looks like for you, and then can see very slight deviations and then give you that information. It doesn't say you're getting sick. It says you might be getting sick, and you maybe want to change your behavior as a result.
Very interesting tech. I might have to try it out.
You should.
Tom, it's great to have. I see you're wearing two of them. Great to have you here. Didn't know. Ring, your pointer finger.
Take a look, and then AI will be able to predict all things about your health.
Now, that's pretty cool.
Thank you.
Right, Tom, thank you for being here.
Thank you.
Next Wednesday, December 6th, join the CNBC Work Summit to hear from leaders and experts on the future of work and AI. Just scan the QR code or look at your screen right here for much more information. You can also visit cnbcevents.com/work.